Hi, my name is Moctezuma Garcia, and the following presentation will focus on health inequities amplified by COVID-19. The map illustrates higher rates of COVID transmission in orange among counties with above average Black populations. The following map demonstrates higher rates of COVID transmission in orange among counties with above average Hispanic populations. COVID transmission with counties that have above average communities of color is 13% greater for Black and 18% greater for Hispanic populations. Social determinants of health emphasize the significant role multiple conditions influence an individual's well-being, such as education. Research data has revealed that communities of color have lower levels of educational attainment, which affects health literacy and how to protect against COVID. Socioeconomic status reveals that low-income workers are less likely to be able to work from home and are more likely to encounter being evicted from their homes and experience food insecurity. Healthcare places an emphasis on the government's delayed response to COVID, and lack of organized interventions throughout the US has accelerated transmission of COVID. Social networks indicate that some of the largest COVID transmission networks have been among incarcerated populations. Detention centers for undocumented immigrants have also torn families apart and has elevated COVID-related risks by placing people in confined spaces. The environment, such as the lack of affordable housing and public transportation, may also expose an individual to overcrowding, which elevates possible exposure to COVID. SYNDEMICS places an emphasis on the biological interface of two diseases, creating adverse reactions to the human body that result in harder to treat medical conditions. The CDC indicates that people of any age with the following underlying medical conditions are at greater risk of severe illness due to COVID. The following underlying medical conditions are disproportionately higher in the Black community, followed by Hispanics and white populations. Previous attempts to address health disparities have seldomly reflected on historical events and the role government institutions have played in establishing systemic inequities. The following illustration highlights the biological implications exacerbated by psychological and social risk factors related to inequities of historically oppressed and highly marginalized populations. We must be mindful that the status quo reinforces inequities and profits from the disparities of historically oppressed and highly marginalized populations. Highly marginalized populations continue to be ignored and overlooked in data surveillance systems. Social movements such as Black Lives Matter are starting to hold institutions accountable for their actions and demanding more from their government. Currently, an emphasis has been placed on intermediary determinants of health, which promotes a deficit-based approach for addressing health problems, which is on the right-hand side of the illustration. A stronger emphasis must be placed on the structural determinants of institutions, reinforcing systemic inequities to subjugate historically oppressed and highly marginalized populations, which is on the left-hand side of the illustration. Contact tracing efforts to identify social networks possibly exposed to COVID is less effective among highly vulnerable populations, concerned about being deported or being included in a government surveillance system. We must remember that social distancing as an intervention to prevent COVID transmission is a privilege and may not be a viable option for historically oppressed populations that endure significant inequities, such as poverty, racism, and chronic health disparities. Thank you for your time, and if you have any further questions, feel free to contact me.